Unfortunately, everyone grows old. During this process, some find out that they have a disease. One of the more common diseases that we are starting to see in the elderly is dementia. Dementia is defined by Mayo Clinic as a group of brain disorders that cause the loss of intellectual and social skills. Today, I will talk about the most common form of dementia called Alzheimer's disease, which is the 6th leading cause of death in the United States. You might know someone who develops Alzheimer's, so learning and understanding this disease is important. I chose Alzheimer's disease due to my interest in medical science, but also because I lost my grandpa last year to this incurable form of dementia. He is the only person close to me that I've known with this disease, so naturally I wanted to learn more about it. The questions about Alzheimer's that I will answer in the next few minutes include the symptoms, treatments, and prognosis. The first way to identify if one has this disease begins with knowing the symptoms. According to Alzheimer's Association, symptoms include memory loss, difficulty solving problems, difficulty completing daily tasks, confusion, problems with speaking or writing, and withdrawal from social activities. Recognizing Alzheimer's symptoms is important. However, the brain is changed by the disease before any of these symptoms show up. Those diagnosed past 80 usually live 3 to 4 years afterwards and can live up to 10 years if diagnosed before age 80. The first sign of this disease usually begins with memory loss. At first it is subtle, but increases over time. Eventually the patients will forget daily tasks he or she has performed for years, along with the date or even where they are at the moment. For example, about 3 years after my grandpa was diagnosed, he couldn't remember who some of his family members were. Along with memory loss, confusion begins to set in. My grandpa's mind would take him back to the days of fighting in World War II, and he would think that he was in hiding, not knowing that he was safe in his own home of 20-something years. Withdrawing from social activities is another common symptom of Alzheimer's. Confusion may be a contributing factor if they're unsure of where they are or who they're with, and therefore not feeling confident in participating with their surroundings. The symptoms aren't easy to watch, but there are some treatments that can help with this disease. Unfortunately, there's no cure for Alzheimer's disease, and it does lead to death. However, there are some treatments that aid in slowing down some of the symptoms that I've listed. As for cognitive symptoms, cholinesterase inhibitors and memantine can be used. As stated in a source online, cholinesterase inhibitors work by boosting levels of a cell-to-cell communication by providing a neurotransmitter, such as acetylcholine, that is depleted in the brain by Alzheimer's disease. Diarrhea, nausea, loss of appetite, and sleep disturbances are side effects of this drug. Memantine works in the brain to slow the progression of common symptoms as well. Side effects include constipation, dizziness, and headache. As for behavioral symptoms, some antidepressants are used. These can be helpful, but sometimes antidepressants can increase symptoms such as confusion and risk of falls. The same can be said for anti-anxiety medications too, so the patient's doctor should be consulted first. Now that I've shared with you some of the treatments for Alzheimer's, let's talk about the prognosis. Although there aren't too many options for medications, creating a safe environment, exercising, and nutrition are favorable to Alzheimer's patients. Having a supportive environment is crucial. This allows someone with Alzheimer's to have a set routine which can reduce confusion. The less clutter the patient's home, the better. In addition, installing handrails on stairs and in bathrooms would be a beneficial safety feature. Exercise improves mood, maintains muscle, and aids in sleeping better. Exercise also helps with constipation, and to ensure he or she is getting enough liquid, suggest high-calorie smoothies, water, juice, and other drinks. Following these steps is the best way for one to live the rest of their life with this disease until death. Having discussed the symptoms, treatments, and prognosis of this disease, I hope I've answered any questions you may have had. Now that you've been informed on Alzheimer's, you know what symptoms to look out for, although I hope none of you ever have to use this information in the future. The end.
Did it go dark on you?
Yeah.